So what is vagus nerve, and why do I think that everyone should be paying attention to it? I know it's a big claim, but ever since I started studying about the vagus nerve, I had that mind-blown experience. And now I think that vagus nerve could very well be impacted very frequently in many different conditions, and therefore its proper function might be paramount to our well-being. My name is Dr. Mikola Rashik of Autonomic. Let's get started. And apart from that, I will also talk about in this video on how the vagus nerve is connected to the immune system. A big discovery as well, which was only discovered fairly recently, only in the year 2000. So this connection between our brain involved in regulating the immune system is fairly new. One of the reasons why it took so long to be discovered is because of resistance by the scientific community to consider that possibility, because it was for so long thought that our nervous system is completely independent from the immune system and that they do not collaborate or work together. Now, obviously, that has already been discovered. Only in 2002, the name for this interconnection has been established, and that's what I have referred to in the past videos as cholinergic anti-inflammatory pathway. The key word here is anti-inflammatory, meaning it reduces inflammation. That's the function here. And it's fairly well worked out by now, but the details of that are still being enhanced, and I'll give you an example of that at the end of this video with some of the latest research coming out from this year as well. All right, so but most importantly and most interestingly to me, I felt, is that this discovery has also resulted in really starting a new field of medicine, or at least it really brought it finally to a forefront. And that's referred to as bioelectronic medicine. And so what is that? It's basically the concept of how you could be treating diseases by manipulating or modulating neuronal circuits. And the poster child for this is vagus nerve neuromodulation, which has already been approved in the US by FDA as a treatment for both epilepsy and depression that are resistant to treatment by drugs. So in the context of these two conditions, when medications didn't work, that's now a potential treatment. And this is a perfect segue to mention the sponsor of this video, NeuroSim, which is a device for vagus nerve neuromodulation. And more importantly, based on what I've seen on their website, this device is approved for medical use in Europe. So clearly keep this in mind as I elaborate on how important the proper vagus nerve function is to our health, and when I describe some of the symptoms that can be produced as a consequence of when the vagus nerve function is not ideal. And if you are thinking of sounds like a vagus nerve symptom right there. You'll see what I mean. And if you are thinking of using this device, then there's a couple things I would want to mention to you. Number one, use the discount code provided in the description as well as the link, and then you can save yourself some money. But number two, if you decide to ever work with your vagus nerve, I highly recommend that you talk to your doctor, because of this information could be extremely valuable to them as well. And you'll see as I elaborate on this why, because the vagus nerve could be influencing so many different functions. All right, so then let's break this down. How was this discovered? So how did this cholinergic anti-inflammatory pathway come about? So first, what is inflammation? Inflammation, well, we all hear about this, right? What is inflammation? It's a process induced by your immune system in order to achieve one of two things. Number one, it is to destroy an invading pathogen, okay? Or number two is to repair and maintain your tissue, your own body. An example of that would be removing cancer cells. So clearly, inflammation is an extremely powerful and important tool at our disposal, but it's also dangerous if it's dysregulated. And the reason why is because, as I just mentioned, it's used to destroy things. So this is why having acute inflammation or chronic inflammation can be dangerous to you, and those are the type of dysregulations we want to avoid. And a perfect example of that is cytokine storm that we heard about early in the pandemic. And the reason why is because in that instance, the immune system was producing too many inflammatory cytokines, and this can lead to destruction of organs and even death. So clearly, proper maintenance of inflammation is needed because you only want to have that experience absolutely when it's necessary for your well-being and your survival. Okay. Now, before I go on with explaining how this pathway was discovered, let me introduce one more element to this story, and that is the concept of lipopolysaccharide. Lipopolysaccharides are basically parts of certain bacterial walls. And it's been known that exposure to lipopolysaccharide can result in acute inflammation. So it's been used experimentally for a long time in order to induce inflammation and study inflammation and so on. And the authors who were using lipopolysaccharide to do this, they discovered that this inflammation, acute inflammation, could be stopped or prevented with acetylcholine, which is a neurotransmitter, which basically means it's a chemical used by our nerve cells to communicate with one another and communicate with the rest of the body. All right, so that was obviously intriguing, and this neurotransmitter, acetylcholine, is a big one in the use by the vagus nerve. So they also looked and showed that another way to stop the inflammation induced by that lipopolysaccharide, which, by the way, I also mentioned once before in one of my videos, so check that out. One way to prevent that inflammation was by electronic stimulation of the vagus nerve, which is what I refer to as vagus nerve neuromodulation. So altogether, this has shown that in order to achieve this anti-inflammatory effect, you needed the vagus nerve, you needed the acetylcholine neurotransmitter, and you also needed the nicotinic acetylcholine receptor, which is basically the receptor that binds to acetylcholine, which is how the information is propagated from one cell to another. Okay, so then, since then, it was also discovered that spleen and splenic nerve is also needed for this, but I'll talk about that at the end of the video when I explain the latest research. All right, well then, let's talk about the vagus nerve. So what is this all about? Now, vagus nerve is part of your autonomic nervous system. So what is that autonomic nervous system? That's the component of your nervous system that is responsible for regulating all of your body functions you don't have to think about, such as, for example, breathing and your heart rate. So clearly an important component to keep you alive. It's absolutely paramount to our survival. Now, this autonomic nervous system can be divided into three pathways, three sections, two of which are important to this video. I'll mention the one that is not a focus of today's video, which is enteric nervous system. That's the nervous system that regulates and functions in your gut. Very important, but not for this video. The other two are as follows. It's the sympathetic nervous system. Now, sympathetic nervous system is the component of your nervous system that is activated in situation of stress or danger. So that's the one that is activated in the flight or fight response. All right, so it's obviously there to keep you alive, and that includes inducing inflammation. Now, the opposite of that, the one that counteracts it, is parasympathetic. So whatever sympathetic turns on, parasympathetic turns it off. So that's the one that puts you into relaxation mode and calms you down. It's referred to colloquially as rest and digest response. And these two, sympathetic and parasympathetic components of your nervous system, they work in tandem all the time to basically determine your needs for everyday survival. So when the sympathetic nervous system turns on certain body functions, parasympathetic, once those are functions that are not needed, will shut it off, and so on. Now, vagus nerve is the component that is involved in the parasympathetic nervous system. So the parasympathetic nervous system is primarily made of by the vagus nerve. About 75% of entire parasympathetic nervous system is made up just by the vagus nerve. So its function is enormous, and so is this nerve or its network of nerves. It's absolutely enormous. It innervates bulk of your body and innervates most of your organs. So where does it start? And by the way, I thought this was interesting. Vagus apparently in Latin means wandering because it meanders throughout your body in order to achieve all of its desired functions. So it starts in your brainstem, then it goes through your neck, down to your chest. There it splinters into being able to innervate your heart, regulate your heart, your lungs, and then it descends down to your abdomen, where it can innervate your gastrointestinal tract. Okay, so clearly, really widely used nerve. So then what does it regulate? It obviously regulates a lot of your functions that follow that path. So it can regulate your speech, it can regulate your heart rate. As a consequence, it can also regulate your blood pressure, and it can regulate your breathing, and it can regulate your digestion, and also it can regulate your immune system, as I mentioned. All of this combined also affects your mood, so it can also regulate your mood. So it has a lot of big functions. Now, this autonomic nervous system can be dysregulated. That's what is referred to as dysautonomia. And remember, dysautonomia has been observed in some COVID-19 infections. So we're familiar with this, and that's where the vagus nerve comes in. So what are the potential symptoms? And this is where I thought this was so interesting, because the symptoms are extremely familiar to me. So let's go by the tract of the vagus nerve system once again. So it can, when your vagus nerve is affected and no longer working properly, you could experience following symptoms. You could lose your taste. You could lose your voice. You could have acid reflux. You could experience nausea and vomiting. Then we go down to your heart. You could experience change of your heart rate. As a consequence of that, you can also experience change in your blood pressure, as well as even change in your blood glucose levels, which I thought was fascinating. It can obviously affect your breathing, and a lot of people don't understand how important breathing is, not just obviously just to live, but for regulating the proper acidity of your blood. So how you breathe, or more specifically, how much oxygen versus carbon dioxide you breathe at any given time, can affect your blood pH or acidity. And that's a very fine window within which the blood works ideally. If you go outside that window of acidity, you can negatively impact many biological processes. So vagus nerve affecting your breathing is very, very important. And then from your lungs, oh, I think this is dead end. And then from your lungs, you can, of course, it descends to your abdominal tract, and then it can, and other symptoms can include abdominal pain and abdominal bloating. So then it makes you think, listen, these are very common. Oh, and altogether, of course, they also can promote fatigue. And then altogether, all of these symptoms, not only do they just sound familiar when it comes to long COVID, and we covered this already in a previous video, how you can use vagus nerve neuromodulation to improve long COVID symptoms, but also these are basically symptoms that I'm familiar with every time I'm sick. So then my question in my mind was, well, what is it? Is it that the vagus nerve, when it's affected, produces symptoms that are very similar in many other conditions? Or is it the other way around? Every time I experience these symptoms, my vagus nerve is affected. And if that's the case, clearly it means we should carefully pay attention to the proper function of our vagus nerve. And it makes sense to me. And the reason why is because this nerve is constantly active, constantly working, and it's responsive to the environment. And based on how you treat your body, it can affect the proper function of this nerve. So then how can the function of this nerve be dysregulated? Obviously, that's one big area of interest then, right? Like, what could happen? So some of these might be very obvious, but not all of them. So the obvious one is you could have a physical injury to the nerve. So like a trauma, where it can, let's say, break the nerve, and that can even lead to some permanent injury. So that's an obvious. You can be born with affected nervous system. That's also very normal, because like with everything in our body, we always have our own individual fingerprint. So that comes to, when it comes to your immunological response, is unique to you, to yourself, but that is also with regards to the function of your nervous system and your vagus nerve. Every single one of us will be slightly different. So you can be born with differences that can affect how the nerve could be performing. All right, so cancer can also affect the ideal performance of this nerve. And one of the reasons how this could be affected is through inflammation. So another ways you can also affect the function of this nerve is through the immune system. So inflammation, which is so ironic, because here's the nerve that is supposed to be reducing inflammation, that it has the capacity to reduce inflammation, while inflammation itself can reduce its function, right? So that's unfortunate, I guess. And then autoimmune diseases can affect its proper function. But what about some of the other aspects that might not be so obvious in terms of how this nerve could be affected? Well, chemicals can affect its proper function, and that includes industrial chemicals. But I wouldn't be surprised if that also involves certain household chemicals. So you can see how easily potentially we could be perturbing the function of this nerve. Another weird one was amyloid proteins. So what is that? Amyloid proteins are the type of proteins that are not formed properly. Their structures is not as would be expected. It's somewhat deformed, and as a consequence, such proteins can aggregate. So you can think of this specifically when you think of amyloid proteins, you think of neuronal conditions. But remember, I've also talked about amyloid form of clots induced by spike protein, which was very unusual observation, because typically you don't think of amyloidosis when it comes to blood. So, and the reason why that's also interesting is because clotting can also be influenced to some degree, by the vagus nerve as well. So keep that in mind. So again, neuronal damage in the brain because of how what's happening with aggregation of proteins can affect the proper function of this nerve. Another one, surprising one that might surprise you, is type 2 diabetes can affect this. So another symptom you can experience when this vagus nerve is affected is dizziness, or the propensity to feel like you're going to faint when you're getting up. And this experience can be enhanced in type 2 diabetes, which is a signal that the vagus nerve function is being affected as well. Right, and then the final one for the context of this video is, of course, infection. Infection often can affect the proper function of the vagus nerve, and in a previous video, I already made a video talking about how the vagus nerve can be infected by the SARS-CoV-2 virus. So this is how you can have a link between COVID-19 and dysregulation of proper function of this nerve. Okay, so many different ways on how this nerve can be influenced in a manner that we might not necessarily want it to be functioning. And as a consequence, with all of these symptoms and how it can be dysregulated, the vagus nerve, when I just started studying this only maybe a few months ago, and I've already came across so many different conditions in which the vagus nerve function is either suspected or already been shown to be influential and potentially improved through that vagus nerve neuromodulation. So, and I'm sure that I will be discovering additional other conditions where the vagus nerve function is affected and where it could be influenced through vagus nerve neuromodulation. Hence, why I'm so excited about the vagus nerve, why I'm so into it right now. And in my future video, I will talk about my top reasons why I'm so excited about the vagus nerve. This is just simply to give you a background on the vagus nerve, not even yet tell you the real reasons why I'm super excited about this nerve. And it completely occupies my mind right now. Vagus nerve as well as IgG4 antibodies is basically what is preoccupying my mind at the most right now. Now, speaking of which, how does it all work? Now, this is basically the vagus nerve, as I mentioned, innervates big chunk of your body. That information collects information from the body. It relays that information to your brain, and that information is then processed by component of your brain called hypothalamus. It's buried deep inside the middle of your brain, so very well protected, and it relays information live, instantly to the body in terms of response. Okay, so it can be instantaneous. Now, when that information is then relayed back to the body, acetylcholine neurotransmitter is released, and then there's two types of receptors that can respond to that acetylcholine. Number one is muscarinic acetylcholine receptors. So those are involved throughout your body by the different organs. And then there's the immune system, and the immune system uses different receptors called nicotinic acetylcholine receptors. Now, if you're hearing the word nicotine in there, then yes, you are right. That's the same root. And the reason why is because nicotine itself mimics acetylcholine. Therefore, many of the functions of vagus nerve neuromodulations can be duplicated with nicotine. That's one of the reasons why you might have heard this concept that smokers early in the pandemic, it came out to the forefront that smokers were not as severely affected by COVID-19. And this was such a paradox. And this might be reason why is because of the effect of nicotine on these nicotinic acetylcholine receptors. The only problem with nicotine is, of course, that it has additional unwanted side effects. And this is where the advantage of the vagus nerve neuromodulation comes in, because you will not have those additional side effects of nicotine. So once the acetylcholine receptors are activated by acetylcholine, molecular pathways become activated, and they transfer information all the way down to the nucleus. And those acetylcholine receptors, by the way, they are on the surface of immune cells called macrophages. Macrophages are big, important players of your innate immune system. Then that information, once those receptors are activated on macrophages, there's a signaling takes place from the receptor all the way to the nucleus, and what happens is it leads to activation of specific genes. And these specific genes that are being activated basically result in the anti-inflammatory path. So as I mentioned, so that brings me now to the end, and I'll tell you the latest research. As I mentioned at the start of the video, that the spleen, it was discovered that spleen is also required for this anti-inflammatory pathway. And this was a bit of a surprise when this was discovered. And the reason why is because spleen is not innervated by the vagus nerve, which is one of those few organs that are not innervated by it. But vagus nerve does come in contact with the splenic nerve elsewhere, somewhere else. And the splenic nerve itself innervates the spleen. Now, spleen is the organ that is important for your immune system, and it is especially required for activating those macrophages that can either produce or diminish amount of tumor necrosis factor. The reason why I bring that up is because recall in one of my previous videos I was mentioning how inhibition of the tumor necrosis factor cytokine can prevent the IgG4 antibody formation in the mRNA vaccinated. So then what's going on? Because of so basically the vagus nerve, the way it works, it's a two type of nerves network. You need the vagus nerve and you need the splenic nerve. So there's tandem behavior. So not only can you activate macrophages in different areas of the body through acetylcholine, you can also activate macrophages in the spleen. But the spleen nerve does not release acetylcholine. It releases norepinephrine, and that acts on beta adrenergic receptors. So for some time, it was believed that in the spleen, what happens is that norepinephrine activates certain T cells, and then those T cells, once activated, they are the ones that would release the acetylcholine to activate macrophages. And in the latest paper of this year, some authors showed that that might not take place at all. So there is no T cells involved in between the splenic nerve and the macrophage activation, but rather these macrophages in the spleen could be directly activated by the norepinephrine via beta adrenergic receptors, While on top of that, we do know that vagus nerve can activate other macrophages elsewhere via acetylcholine. So that basically shows you that we are constantly learning new concepts, new ideas, and we are always expanding our knowledge when it comes to science, especially in a field as complicated as the immune system, which is very, very vast. And this is a perfect example where it's merely just over 20 years ago that we discovered the whole new concept that the brain interacts with the immune system. And that is a very powerful interaction that can actually reduce your inflammation. All right, that's all I have for you today. Big video, big topic, but I really wanted to give you a big introduction on the vagus nerve. I've been studying lots on this, so we're learning this together. And in the next installment, I'll tell you why I am particularly excited right now about the vagus nerve and the possibility of being able to modulate it. All right, so stay tuned for that, and I look forward to seeing you in the next installment. Bye everyone for now. Ciao.